Okay, welcome everyone from around Australia, and we've got our guest today, Peter Kelly. So Peter, as you saw in the blurb, was the senior psychologist at the Health and Safety Executive of the UK. He's been there for about 23 years, Peter.
Yeah, that's right. Yeah. I went on walkabout and didn't come home. So.
Yeah. And I was lucky enough to meet Peter actually because we were both in lockdowns on either side of the world. And he was running some sessions that were just coffee catch-up, virtual coffee catch-ups, which drew people from all over the world that were in similar positions. So when Australia started to go back into lockdown, various states were in that area. The Australian Institute of Health and Safety decided that it would be a great opportunity to reach out to Peter and see what his insights might be into managing lockdown. So we have Peter here today, and so I'll just hand over to Peter to introduce himself. Add any more to that?
No, I think that's pretty much it. Yeah. So living in the UK, we've been through 3 lockdowns now. And during that time, I've been active in advising our own government and the Health and Safety Executive who I work for around how to manage people's mental health. I was doing that before, but it's become very pertinent, obviously, during the pandemic that what we do see is that people's mental health is impacted. So if it's all right with you, I want to do a quick presentation, which will take you through it. Let me see it. There we go. And then we can have some questions. So if we were to, let's see if that works. So living in lockdown, the future post-pandemic of mental health in the workplace. I think the first thing to remember is this is a time limited thing. So lockdowns happen. They happen for a couple of months. They might happen for a few weeks if you're fortunate. But in many cases, they will happen for over a period of time. And as we go through the course of COVID-19, what we're discovering is that we get into a pattern where lockdowns become a bit more regular. So we're going to have to learn to live with it and live with it both on a practical level, and that might be, your hand sanitizer, your mask that you carry around. Now, these are practical things that you facilitate and that you can have, but mentally. We are not, and we have never been really prepared for multiple pandemics. And I say multiple pandemics because a recession is a pandemic. An influenza pandemic is a pandemic. We never had both at the same time. And COVID-19, so certainly is a game changer. Coronavirus 19, cleverly illustrated here, is very interconnected, isn't it? And that's it. That's its thing. One person gets infected. Other people get infected because of one person, then you get to the R rate. So that there's a physiological path that the virus takes, but also what there is a very clear psychological impact. So it's psychological in people and the way that it's impacting. So our mental state is very much a part of that journey and a part of understanding what COVID-19 is doing. What we're seeing with COVID-19 is an increase in people's mental health issues. Okay, so we are seeing rises in mental illness, something in the range of about 20 up to 20% increase than on previous years when people have gone into lockdowns. There's certainly, just to give you an illustration, in the UK, currently 48% of all sickness absence in the NHS is down to depression, anxiety, and stress. Burnout, because of the physical nature of dealing with the crisis that we have over here, has had a direct impact on people's mental health. So we know viruses do attack people's immune system. They do a range of things, but they also deeply affect people's mental health and the way they view it, their own mental health. Because what we really want is to have a normal life again. We want to go back to when we could go to the clubs or go to the rugby, the football, enjoy ourselves, have a great time. go to work, chat with our mates, do all the things that we considered normal, and we just took for granted. And then suddenly they're not there. And that's the thing about this virus. It's changed the way we work, how we interact with people, the way we socialize. If you have moderate neurosis, it's increased it because of, if you suffer from anxiety, then the fear of catching the virus, can cause multiple issues in terms of people's psychological self. So, and we're going to come a bit to what has really come out is isolation. We don't do isolation. We're not used to being forced into isolation, and we're not therefore really coming to terms with what loneliness means. I live on my own, and during these lockdown periods, my only sort of interaction with the outside world is when I go on my allowed walk. And I would make sure that would last an hour or two, so I could wave at people from a distance, just so I could feel interconnected with what was happening in around me and around society. I did this coffee at 2:00 with Pete, which I've run for the whole of the lockdown, because when we first went into this at wave one, people were like, I don't know what to do. I've always been doing something like this. And I said, well, sometimes you just need a break from what's happening and just to chat and have a coffee. So it was. And I've carried it on, and people still jump in and say hello and have coffee and that. But it's just a way of normalizing a very abnormal situation, because you forget how many times you sit around a kitchen and have a cup of tea with somebody in the office, or you go for a beer, or you have lunch and do it. And the things that you took that just normal and routine aren't normal and routine. So you've got to replace that with something. What I want you to have a look at is, this is a slide about looking really at how people's mental health is impacted as we go into various challenges. And the reason I use this is, if you see this is it's called the reaction zone. It's the course of stress reaction. I want you to notice the line going up the side, which shows a gradual increase to a very sharp curve. We all know about curves now. We talked about 2 years ago. What do you mean? What's a curve? Now we all know about curves. So what happened is, this is where people start at wave one. So they start with, oh, it's okay. It's going to be fine. We're going to be okay. Oh, geez, this isn't great. I'm not quite sure what's happening here. And we get to the top of the curve, and it's like, oh, that's it. So this is bad, but that's okay, because we lock down, and then we get people adapt. So they go, right, I'm adapting. Because you're in lockdown, you're not allowed to do anything, so you have to adapt to that scenario. I want you to look at the right-hand curve there, yeah? And where that line is, that is what is happening when people are coming out of lockdown. So the mental health reaction is way quicker and far more sharper as you go through the waves. When wave one first came in the UK, this adaptive zone stayed pretty static. On the second wave, we were getting mini spikes where people begin to lose, begin to become upset. Isolation kicks in, loneliness kicks in. So what we do know, and we have there's a book by Stephen Taylor, The Psychology of Pandemics, is this is a very predictable response to a pandemic event. So psychologically, we react and respond as we go through it. So the science behind it is robust, and actually you can track it. You can track how people are going to respond in a pandemic. As we work to find our new normal, we need to help each other to stay strong. What is the new normal? Over here in the UK, although we're opened up and we're doing that, we don't have full occupancy in offices anymore. People are now looking for flexible working options. They want to work from home for 2 days a week, and maybe go to work for 3, or the other way around. And what's interesting was, when they said to you couldn't do flexible working because the systems and processes weren't there to do it, what's actually happened in the context of workforces now is, we did it. We closed down entire industries and we moved them online, and people did it. So the IT bill was there, but what we found during the process is that people began to feel detached from their workplace. They were working, they were sat in their office, they were doing what they're doing, but they weren't connected with what was happening in work or happening around. And it starts impacting their friends group because they weren't allowed to meet as friends. Because people were obeying the rules, staying safe, keeping keeping themselves isolated. And that's when, as we've done that, we begin to see this new norm. And that's why it's really important. We need to help each other to stay strong and be hopeful, because social distancing doesn't have to mean social disconnect. When we started out in wave one, what was coming across was people like were lost in their own self and their loneliness. So during the coffee at 2, or I have a pub at 8 o'clock at night as well. So you can come to it facilitated the possibility for people who are on their own or just wanted a break to come and have a beer if it's 8 o'clock at night, because that's okay, or to come have a coffee in the afternoon, so they could connect with people. The feedback as I was talking to people is like, I just needed something to dip into, because I'm managing, but actually there's points when I feel really isolated here. I feel lonely in my sort of office space where I am. So the social disconnect is a consequence of social distancing, and we need to find ways to reduce that. This is in Wuhan. This was in the first 2 weeks of the lockdown, and I love this because what this shows to me is the characteristics, I think, which are important, is we need to help each other. We need to show empathy. We need to show compassion, and we'll talk about that shortly. But this was them in the ICU, preparing each other as they were going in to treat in the very first stages of COVID-19, done by a Chinese artist who was commissioned to do that. So here we are, nearly 2 years later, and the same traits and skills that are needed to get people through. We need to be able to reach out and hold people through this process, right? There's ever a time to show those human traits that we all have. It's now. What is wrong about reaching out and holding on to somebody and saying, "I've got you back"? It's virtual because you can't necessarily hold their hands, but you can virtually be there for people, and you can actually. So if you're a manager and you've got somebody in, that you're managing, don't just go in there and do the standard, how's your day been, and what's your workload. Why don't you actually just take time to actually have a coffee with them, or have I've advised a couple of people who run companies. I said, have a 5 o'clock session, and I said everyone comes on at 5 o'clock, and you have a glass of wine in your hand, because it sets the tone, which is, this is just going to be a relaxed time, guys, and you set, as leaders, you set that tone. And that's why it's important that we do, as leaders and as individuals, show compassion, because all of these things here, this is a Twitter bomb, are the consequence of showing compassion, joy, sincerity, love, and a number of other things there. But they're all positives, aren't they? And empathy creates connection. You hear it, you're present, and it's about doing that. And these are not like, oh God, I need to be a psychologist to do this. These are things that you have and that you do, and you should really, they're natural human emotions. Ultimately, what COVID-19 has done is drawn people together, but it's also separated and pulled people apart. And what we need to do is come together to support each other. So living in lockdown is about connection, it's about empathy, it's about support, it's about working together with people, and it's about being honest and open that this is an unusual situation. And that's it. So when people are experiencing mental health issues during this time, I like to say to them, well, it's a normal response to a very abnormal situation, and we have to demystify it, and you have to find things that you yourself can do that give you some fun. I've got a longboard here. I go off my longboard. People laugh at me because I'm 54, but I feel free on it. And you know, I go for lots of walks, and you have to basically, you and the people you manage or people you work for, just make opportunities to create connection. And that's a stop share. There we go.
Great.
I told you it'd be 15 minutes.
Yeah, you did. Yes, you gave us a lot of great suggestions there about opportunities. So sitting down and have a 2:00 coffee with your team, having a casual drink at the end of the day to connect, making sure you make that time, not just jump straight into business on the Zoom. So there's some really great initiative opportunities that people can put into practice in their own workplace whilst they're there. What else have you seen that other workplaces have, or other people have talked to you about it that they've used? What other strategies have you seen that perhaps we could share with the group?
So a lot of people have created like these their own sort of social events online. Like quizzes or get-togethers or fancy dresses, and you know, what people have tried to do is substitute the world that they knew and transfer it into this virtual world. But the most powerful thing you can do is actually to pick up your phone and phone somebody and talk to them, because that's what we miss. We miss that voice, the connection. And actually, if you're on a Zoom call and there's 8 or 9 of you, you can have a bit of a laugh, and it's good fun. Or Teams, whichever platform you choose to use. But that doesn't beat or why wasn't John there? And someone needs to notice why wasn't John there, because that John himself might be struggling, and he actually, the thought of going on a webinar with a load of happy people might actually not be his thing. So I've often, if I'm in a meeting and someone's not there and they're not there a couple of times, I might just give them a call and say, look, hi, it's Pete, just thought I'd check in. And that's what I've talked about on my LinkedIn, is checking in on people. You don't know what people want until you reach out, and they can reject you, or they could actually say to you, you know what, I just really needed to talk to somebody. I just needed, you know, they're not going to tell you necessarily their problems, but they need to talk. So I would say create opportunities to engage. Look around your neighbours. If you've not seen your neighbours and you've got your neighbour's number, phone them up, and say, you know, oh, look, are you okay? Is anything I can do for you? I'm going shopping. Can I do these things? And then you go for shopping, you leave the shopping outside the door, you step out the door and you do that. But you see, when they open the door, you might be the only face they've seen all day. And even the fact that they're seeing you from 6 feet away, it's connection. On my birthday in the first lockdown, my mates turned up with a cake and some beers and some presents, and left them on the door, and they all stood 2 meters from each other and sang me happy birthday. You know, and the cake was rubbish, but it didn't matter, because for a moment there I felt my mates had got my back, you know what I mean? And so there are things like that. If you know you've got friends who struggle with anxiety, then reach out to them, because they really will struggle with this. Because it's very easy to get to a difficult place if you've got health anxieties and you're in a pandemic. So
I guess we've talked about a lot of strategies that people could use, particularly with friends and reaching out whilst they're in lockdown. What do you think are the most common challenges and issues for workers and managers during a lockdown period of time?
Yeah, that's communication. You assume you're communicating, but you aren't communicating, you're dictating. So you cannot manage people in exactly the same way as you would manage them on a face-to-face level, because you're in a virtual environment. And actually, the skills you need to support people in an enforced lockdown are different than the skills you need to support them in an office when they've got a load of support around them. Karasek, who is the godfather of some of the theory, Karasek talked about high demands, low control, and high demands, low control, and poor support. But what does the pandemic do? Okay, it is the seminal event, is it not? It's in the early stages of the pandemic, when we first wave one, we saw a reduction in demands with a complete loss of control. And then what came out of that was support. Now, what we're seeing is actually control and support. Low control and poor support are characteristics that are coming out in stress cases. Wave two, we begin to see an increase in demands and low control and low support, because actually the virus takes away that, doesn't it? The virus takes away the ability to control. It dictates where and when and how you're going to work. And if it locks you down, you get locked down. And now what we're obviously 18 months in, we've got high demands, low control, and very poor support. So we have what I've talked to you about, which we have a perfect storm in terms of mental health, because we're not actually adjusting workplaces to reflect the new norm, as Morgan Freeman put it. You know, we're actually trying to work like we worked in the old way, and actually the old way doesn't necessarily work. We will not be back in open plan offices for another 2 years. And then we may not even get full occupancy in open plan offices. Businesses are now being told by their employees, I want to have flexible working. The business no longer can argue you can't do flexible working, because it's had to make you flexible because of the pandemic. So I think, what was the question? I just went off on one there.
No, you did answer the question. It was around what do you think the big challenges are? And I think I gleaned from it that you've got to manage differently. Can't use the same principles, I guess, that we did before we were in lockdown and apply it just now to a virtual world. And I think that rings true, because I have a lot of colleagues who've said they actually work more when they've been in lockdown at home, because they can just take their laptop and sit in front of the TV and continue working. They probably put in more hours. And so my personal reflection is perhaps still having the discipline to be able to switch off. And it would be very important from my perspective that a manager gives you that permission or encourages it, as you said, leads by the example.
Yeah, absolutely. If you don't,
I'm checking out now. I'm having a wine. How about you? Yeah.
If you don't do that, you don't set the precedent. You know, we're not made physically, physiologically to function for 14 hours working. It's just that our brains biologically are hardwired for 3 things: sleep, rest, and work. And we should get, we need sleep because the brain needs to recover. We need rest from work because we need to improve our well-being and health. And if you're working 12, 14 hours, then you're missing one of the other components, aren't you? Which is you actually need to break. You need to break away from work. You're not effective. This is what people think, that between 9 to 12 hours, the performance rate of people decreases and the potential for accidents increases, because actually they're not as effective mentally, because they're more likely to have a delayed response to an incoming risk. So people say, oh yeah, I'm okay, I'm doing all these hours. Your employer ain't going to pay you any more for doing those extra 5 hours. And if you are doing an extra 5 hours and you feel you have to do the 5 hours, then your employer's system is wrong, not you. You know, this idea that you have these you know, Google Meets and everything else, and we had this live session. People need to be present to be working. You know, what we discovered during each of the stages of pandemic, both here and in the US and Canada, is that actually that's not true because being present doesn't mean being connected, and doesn't necessarily mean you're producing the right. It's the quality of what you do, and there's a bank that universally said, right, all of our people are coming back into the office in the States now. I will tell you now, within 6 months, and they were about 2 months in, I'm already hearing they're going to lose shed loads of stuff. And those staff will go to an organization that says, we'll let you work with flexible working. And that is what's going to happen. Employees will walk with their feet when an employer isn't providing and looking after their health. The old model of you must be in the office to be productive won't apply, because they've been productive outside of the office.
Yeah. So I guess bad practice would be, as you talked about, just mandating everyone to come back in, and that very dictatorial approach again back after a lockdown, and particularly when people may not feel that psychological safety to be back into the office.
If you've been in lockdown, so let's say you live in Melbourne, you've been in lockdown, you're going on the tram, and then, or you go on a train to get in. The very act of going into work becomes stressful.
Yeah.
And that's what we've seen in London. The very act of going on the tube or on the bus was stressful. So by the time the person got into the office, psychologically they were already tense, because they've gone through, oh God, that person stood next to me, and actually for 3 months I haven't been with any, and then suddenly this person's like, move within my 2 meter range. Well, you're on the tube. You can. It's a crowded environment, and then they come in, they're all like pretty intense, and then they're supposed to jump straight on their computer and work. But actually they've got no downtime, and it's that downtime that's really important. So I was saying to employers, well, when they come in, if you know they come in the public transport, just tell them, go and get a cup of tea, before you start your work, and give them 15-20 minutes just to, because that 15-20 minutes you think you're losing, you gain through productivity, because that person's head is in a better place.
Have you heard of any organisations that are doing what you would view to be best practice in terms of managing their staff whilst they're in lockdown, that perhaps people could refer to or connect to?
There's some of the larger organisations. So I was thinking, I work with BT, and BT did some really excellent work, and in terms of supporting their staff, and but then I worked with some really small SMEs who just called in and checked in on people, and actually it's about trust, isn't it? It's that relationship about trust. If you feel trusted by your employer, then you're more likely to feel engaged in that, and have a good conversation and chat with them. And I actually think there are many examples of organizations who just went, right, well, our people are our priority, and we're gonna take care of them, and then at the end of this pandemic we're gonna come back in the office, but there is no pressure to be there. There is some companies now that are saying they might even, their staff only might even come in the office about once every 2 months. If that's what you want, that's fine. It wouldn't suit me. I like to be out and about. So I've got my first face-to-face conference tomorrow in Birmingham, which would be nice, because I've done hundreds of these webinars. It'd be nice to see people, and sort of engage with people. But so there are there, and I can. But they're so even if you just search on Google, if you search health and wellbeing initiatives in COVID-19, you'll see a range of stories that will come up, and you can sort of use it depending on what company you work for. If it's a large company, then what systems and structures have you got there in terms of supporting your people? But ultimately, if I sit down with a board of directors of a company, I will ask them, how do you want to be treated? Not as the manager, but how would you as a person want to be treated in this situation? well, I'd want someone to care for me. And yeah, absolutely. You'd want someone to ask, how are you? And is there anything we can do, and be available, and be, you know, transparent. This idea that you leave your emotional integrity at the door, for me, doesn't work. You know, you don't just go, oh well, I'm not going to show empathy and compassion, which I show to my kids, my family, and my friends, but then I go into work and I act like it as a robot. That doesn't work. It really doesn't work in a lockdown. You've got to find your space where your employees feel, and you feel like that you're cared for. My boss, who's retired last couple of months ago, every morning he'd phone me, he'd text me, and he'd say, "Get out of your pit. I know you're in your bed." But you know, actually, I had a good, you know, my relationship with him was excellent, because I probably was in my bed. But it was his way of, like, you know, just checking in and making sure I was okay. And I think there's small little things that make the difference.
I really like how you're talking about it might be different for different people as well. So that yourself, your personality type, and your needs about work, some being connected to people. Others might be more comfortable continuing to work at home because they want to maintain their connection with family. So as you said, just asking what's important to them.
Ask people what they want and what works. And if you can adapt to it, if they want to come into the office, they will come in the office. If you are working at home, then there are things you have to think about working home. Your IT system has to be right. Your office has to be right. You have to have a space that's separate from the family life. You need to disconnect from work and family, otherwise the interplay becomes a problem. And we know psychologically that will lead to people experiencing you know, a level of frustration, which will lead potentially to them showing symptoms of work-related stress or depression or anxiety.
Okay.
Connection and disconnection from very clear roles, that's the thing, isn't it?
That's right. I might open it up to some questions from the listeners. So if you can put your questions in the chat box, we'll ask Peter a few questions on your behalf. But just one question while we're waiting for that. You've been involved in the ISO 45003, the psychologically healthy workplaces international standard. Well done. So that was, I believe you started that in 2009.
Health, safety, and well-being.
Thank you. Sorry. So how did you come to be involved in that?
I was late to a meeting. So no, we got involved because the standard was ticking along, and it was like we'd seen the first iteration. We were involved, and I'd seen the first iteration. It was like, it's 90 pages. There's no way people are going to look at 90 pages of information. And also, it was done with very technical language. So basically, we were asked to send an expert from the UK, and a couple of my mates were on it as well. They said, "Oh yeah, you need to get Peter on." So it was kind of one of those. But it was 3 years and a lot of meetings, a lot of discussions, and a lot of disagreements. As you do in a standard, you've got to find your way and work along until you get something that you're happy with. So 45,003 sits under 45,001, which is a safety management system standard, and it effectively, I think it's done the things I would have wanted to do 20 years ago when we launched the management standards, which is to put a structure and a system around the standards. And as a regulator, I'm looking for what an organization does to manage mental health. And I'm looking to see if they've done anything around the systems and processes. And 45,003 gives you the opportunity to put in a can-do act approach to it. And it's it uses the hierarchy of control model, which is in 45,001, but it's applied under primary, secondary, and tertiary. So that would be primary organization, secondary training, and what you do with your managers. And actually, secondary is really where most have the overarching well-being, health and well-being comes into play. And then the tertiary is where you're actually with dealing with an issue, and you've got people out, so it's an individual level. And that's where all the research is in primary, secondary, and tertiary. But most interventions that we've seen at the moment globally are around tertiary, because it's cheap, it's cheerful, and actually we think we're doing something, when actually all we're doing is effectively educating people, but not really addressing the system and process work. So I work with mental health first aid, and I'm really happy that we have 240,000 people who are trained as mental health first aiders. But I would be more happy if I had 240,000 organisations that actually looked at the stresses and their mental health, and looked at the systemic reasons why their mental health is happening. So let's have mental health first aiders, but geez, give them something to go to after they've got someone with depression or anxiety, because otherwise it's like the emperor's clothes, and you're sort of preparing and giving, but then taking it away. You're showing empathy and compassion in the workplace, but then you don't have anything in the workplace to refer or address that mental health. And what we know is intervening at a tertiary level is way more costly than intervening at a primary level, at the organizational level. And yet we invest thousands, if not millions and millions of dollars in tertiary interventions and I think that's where we've got to address the fact that organizational elements can be a contributing factor. Depression, anxiety, and work-related stress is an outcome.
It's been funny because as a lockdown and being made to work from home, that's structurally changing the design of work, really, already.
Well,
so I guess then it might be opportunistic for people or organisations to have a look at some of the practices that they started to implement and see how they actually fit into this framework that the ISO 45003 has, I guess. They can take
you put it in there. You put it in there and you put the system around. You've got to show what you're doing. If you want to protect yourself from claims through the courts or from the regulator, you need to be able to showing, obviously out myself as a regulator or the courts, that you've done something to mitigate the risk. And just simply telling someone, having someone listening because they've got depression and anxiety isn't mitigating the risk. It's actually raising the risk. So you have got a problem. I was thinking of a recent piece of work where, did you have a problem? Yes. Did you do anything about it? Well, we did. We did it. An EAP. No, but did you deal with the systemic issues? And that's for me, because if I can, I look at the system and see how does the system sort of function. So yeah, having it there would be useful. It's not a defined standard, so it's voluntary. Some countries may choose to adopt it. It fits well with the Australian standards that have come out, I think it was about 6 months ago. And I often I look back at Australia with fondness, because sometimes you guys are just doing the things I'd want to do or I suggested we did, and we've not been able to do it. Beyond Blue was a really good example. A really great intervention. Mental health first aid originated in Melbourne, the University of Melbourne, as a community-based intervention, doing great work. There's a number of really innovative wellbeing programs that you've got running. Through my contacts in WorkSafe in Queensland and Victoria and New South Wales. You've got Jason who works in Perth through his organisation, and yeah, Jason, God, he'll do my head in if
I can't pronounce his name.
Hey?
This is recorded too, and I can't pronounce his name, but I listened to him on podcasts. For those who haven't, he's a great podcast. I'll send it.
Yeah, so we both do podcasts. Jason's Vanchi, that's it. We both do podcasts on psychological health and safety. So check his podcast out. So his is the Aussie one, and mine and Sheila is the UK one. But yeah, you've got some really great sort of forward-thinking organizations and regulators. So it isn't that you're behind in any respect. In some respects, you're ahead in certain areas. But what you've got to do now, because of the lockdown, is adapt all of the policies and things that you've got into a work environment which has been effectively forced on people.
Mm.
And the IT issue, as your colleague said in the questions, is a fundamental issue across the globe. Broadband was effectively developed as for home broadband, was developed for streaming and maybe doing a little bit of kids work. It was never to have the entire country to sat behind a computer and working, absolutely thrashing the service of the broadband providers. One of my friends is a broadband engineer, a senior broadband engineer for a large broadband company, and I asked him, and I said, well, is there a massive difference? Oh, he went, oh yeah. It's just like, it's, in terms of the usage, it's just incredible. He went into the various different elements of terabits, and actually what you've seen in the lockdown is, is a massive expansion of that. Because everyone's sucking out the whiff as they're going through. And it's kind of like, so it drains the system. Like you could always tell, like with the rugby league final, that there's an increase in electricity, and there's a bigger increase in broadband. So they were always predicting those. You can predict it based on events. But what the lockdown did was really thrash the system and show up the compromising issues that IT systems had, where they weren't really ready for working from people who are working from home.
Yeah, that's right. Just got a question come through. Right. Whoops.
We're on the chat.
Bit of a long one. Can you provide suggestions to support suggestions to provide support in real time, practical for hospital workers on the front line? Their shifts are full on from when they start to when they finish wearing full PPE. Mental health first aiders are in place, and their access to employee assistance programs is available. Can you comment anything more on opportunities in the hospital setting, I guess, Peter?
There's a psychologist I work with who gave me the Nicholas Weissen. He's actually in Sweden, and we worked together on that graph that I showed you before. But he's done some work. He's done Weissen, I think it's NICWISEN, and he's done some work on ICU on preparing people psychologically for COVID work and COVID-19 work. And there's been a number of studies that have shown that. There's a paper by Kelsey in last year, 2020, May 2020, in British Medical Journal, and it talks about the impact on healthcare workers, but it makes suggestions in there of what you can do. The thing to remember, right? Anything at the working within the healthcare service, working within teaching, and other professions has one key element: it's a vocation. Okay, so it's a vocation, which means that these people are driven by different emotional drivers. Sorry, I'm in the sun, which is a very rare treat.
Yeah, we've been struggling with it a bit. Thanks. That's
in the UK, the 26th apparently we're in a heat wave. What was I saying? I've lost my train of thought.
talking about being vocational work, so their emotional connection to the
career are more susceptible because if the system fails to support you, it's against your own value system that you've come into, because you've come in there to support and care for people, look after people, or to teach people, or to train people. And the thing that we found in healthcare globally is actually there's a disconnect between I'm going to be on the front line saving lives, but actually the system around me is failing and doesn't actually support me. And they end up coming together, and they come connected together. Only last week I was talking at a global seminar on summit on physician burnout. There are swathes and swathes of qualified healthcare workers that are leaving the profession, swathes and swathes of teachers that are leaving the profession because they've not been supported. They've not been there. So actually, you need to have something in your work and in your place of work that recognizes the psychological impact of being on the front line. It is clear that the front line has a deep psychological impact, but can be mitigated by feeling supported and by people, giving people a degree of control. I was talking to a mate of mine who's an ICU nurse, and he said, well, I can go up and I can do all the PPE and do everything. But he said, but the thing that's really important to me is the camaraderie that I get with my colleagues on the ward. And when a patient's died, taking the time just to absorb the fact, that person's died, and to work with them. Because they were talking about doing video calls with family members because they couldn't come in the early stages of COVID. And actually the mental impact of being there and watching a family members having to connect over an iPad, but they were holding the iPad for them, was huge. And actually, they needed the support of other people around them. They needed to feel that their colleagues had their back. But the organization needed to recognize that this actual process of going through this has got a psychological impact. So, use the internal resources of your own team that are there. In a hospital, put in almost like not a triage, but put in things that actually give people the opportunity to have time out. If a patient has died on a ventilator and you're going on to the next patient and you're going on to the next patient, but you're not having anything in between, then you're going to get tired and you're going to get worn out, and you're going to feel you need, often when you talk to people, healthcare workers, I just needed 10 minutes. I needed 15 minutes. And then afterwards, they need somewhere to talk. So make available counselors, make available a support system to back people up. And more than that, do what I do. Have a coffee. Go and say, look, let's go and have a cup of tea. Let's go and have a coffee. And often that, taking a person aside and having a cup of tea and a coffee just for 10, 15 minutes or 20 minutes can be the difference. We all are in this together is the statement, but we need to, if we're in it together, we need to support each other together at the same time.
I think a lot of people might say, or you might hear, we just don't have the time, we're so busy, we're probably short-staffed. There are a lot of challenges, particularly in the frontline working in aged care. We're a bit short on people, and I'm sure there are a lot of other sectors in the same boat. But you talk here about just they're small things. They're like 10 minutes here or 20 minutes there that hopefully we can make the space. And as you talked about earlier, that short period of time that you give, you'll get back in spades.
Because you get a commitment from the people and they feel cared for. The whole, as a vocation, you choose to be a nurse or a doctor, and you work, or the care work, the auxiliaries and the cleaners. You work in that environment because you want to give back to society, and you deeply care. You care because you get paid a rubbish wage most of the time, unless you're a senior consultant or something like that. But you do it because you want to get. And when you're faced with this crisis, and everyone comes together. Well, when that crisis is gone, the support system still needs to be in place. We had over here, let's clap for the carers, okay? And we did that for 8 weeks, and we clapped for the carers on Thursday. But when I was talking to some of these carers, what they said afterwards was, well, when they stopped clapping for the carers, it was like, that was it. You've done this for 8 weeks. Do you know what I mean? And not, it wasn't like, well, what happens beyond that? What happens with, what happens beyond that is 47% of sickness absence in the healthcare workers is depression, anxiety, because we didn't go beyond the platitude of banging a pan.
Yeah. We've got Are You OK Day here on Thursday. I don't know if it's a global thing, but Are You OK Day is here. And I guess that's the big challenge for organisations is, yes, you can celebrate that day, but it's really about making sure that we create the structures within a workplace that keeps people feeling that it's okay to not be okay, that they can speak up and they can say something. And that, as you talked about, they feel supported if they aren't. So I think that's a lot of our workplaces will be doing something for that, but it's also a really good opportunity to remind ourselves, as you talk about, the importance of the system around work.
You wouldn't expect me to say anything different, but it's 300 days, it's 352 days a year. Are you okay?
Yeah, that's right.
Honestly, I love it, but they do me head in. Oh, we did it for one day. Well, good. You did it for one day. You gave them the potential of what it could be. Do it every day. Every day you need to say to people, hey, how's it going? How are you traveling? That's what I say to people. Don't say how you are, how you feeling, how are you traveling? Okay. Why? Because between 1 and 10, that gives me a range of options. If one is like, I'm in a hole, then you know where they're at. If 5 is a little bit bumpy, if 10 I'm raging, I'm on it. And actually it's a really good way of getting to understand where people are at. So sometimes in the lockdown, what you'll get, look at that, different sunbits. In the lockdown, what you'll get is days where you're a 5, where it's a little bit bumpy. And there'll be days where it's a 1 or a 2. And actually, just simply asking that question, asking how are you traveling, can make a real difference, because it gives a person the opportunity to talk. Because they might just be in the middle of their own personal thing, and then you don't have to go, well, I've got to refer you to EAP. What do? You have these, and you have that. In the perfect plan of the creator, he created the ability for us to look, listen, and speak wisely. and I think that's I might have 2 degrees, but I just apply my own skills as a human when I'm talking to my mates who are having a hard time. I don't need 2 degrees to tell them and listen to what they're doing. I just need the ability to reach out and show that empathy and compassion. I will not accept, I've got another 13 years of this, but I'm never going to accept a workplace that says it's not good to show empathy and compassion, because if it doesn't, you're lying to yourself, and actually you're lying as you, because really those companies that are successful, that work, that make huge profits, are the ones that look after their people. And the ones that are going to flourish after this are those that look after their people's well-being, their health. And that isn't just about getting a masseur in and giving a load of fruit and doing a mental health first aid. That's about looking at the whole person and the whole person in the system at work. They do that. There are companies that do that, and they're successful. And they're successful because people will work for them. Many of us sit under transactional managers who say, do what I do and do it now in the way I want it done. Okay. Most ineffective way of getting anything done, if you're in management, is being transactional. Transformational leaders make you want to work for you and make you do the work, and you do the work because they give you a vision. Yeah. And it's amazing when you train managers who've not really dipped into transformational leadership styles that suddenly realize, wow, actually I can make a difference by just being me. And we can all shake our heads and go, oh yeah, I can remember a transactional manager, and how did it feel? Didn't feel great. And yet, so we've got all the knowledge that says different kinds of leadership are really important. So certainly mental health, transformational leaders are the future, if not, that's where I think we should be. It's not simply promoting people on the ability to deliver, but on how they deliver.
Very good. Well, thank you very much for your time, Peter. Is there any closing comments you'd like to make to our?
No, I mean, I think we've pretty much just embrace this period. If you're in lockdown now, embrace it and learn, and but reach out to your mates. It's really that simple. I always refer back when I talk about the powerful impact of public health campaigns was get Norm. Remember Norm in the 1970s? Big fat lad, didn't do any health exercise, and get Norm out of his seat. And that was just a powerful campaign, and that prompted a lot of the public health and well-being initiatives around diet and around exercise. And I think we need a norm for the mental health. You know what I mean? I think we need to have a character that says, "Oh, geez, we need to bring them out of it." And we really need that. We really just need to reconnect with our humanity in work. And we need to do that. And we do that well in these lockdowns by just simply asking, how you're traveling. Just ask the question. And it works wonders.
Great. Well, I'll just give you a little memory of home. I don't believe you can get this in the UK.
I can't get squeezy, but I can get the bottle. Yeah.
One of the times I spoke to you, you were eating Vegemite toast.
That's the biggest one I can get, and that's just ridiculously small. So
you probably go through one of those a week.
This is why my complexion and my mental health is so good. I eat Vegemite every morning on my bagel. They have this English equivalent called a Marmite, which is just bloody horrible. Not like Vegemite. So
no. Well, thank you very much for your time. I know it's the start of your day today. If anyone else would like to connect with you or ask any questions, what's the best way to go about doing that, Peter?
Just jump onto LinkedIn. I'm always there. So just do that and let's connect. Have a coffee. It's a bit late for you, but I can do an earlier coffee. So because obviously, mind you, it's okay for you guys because it'll be 10 o'clock at night. So maybe you shouldn't have a coffee then. But I'm just there, and let's connect and see what. But literally, if you've got mates and you got a team, and just take time out, guys. Have a coffee, have some donuts, or do a breakfast one. It's the other thing that people have started doing. One guy, he does sausage and egg in the morning with his team, so they have breakfast together. And he said, we really look forward to it because it's a meeting that's really important, but actually has no structure to it. And for once, 26 degrees, I might actually put my shorts on and go out in my shorts.
Get some vitamin D, absorb it every year.
And that's the other thing. If you are locked at home, one of the things I've found is become increasingly interested in the birds that were landing in my garden. And as you go through lockdown, you begin to name them because you're that devoid of connection. So I had a couple of pigeons here, Penny and Paul, and a squirrel. And I actually used to buy nuts for this, so the squirrel would come and eat the nuts, and I put bird feed out for the two pigeons. And then I got some finches in, some chaffinches, and I'd never seen myself as a sort of bird person, but I suddenly became interested in them. And what we found in the first lockdown, I don't know if you'll find this, if you open the door, it's silence.
Yeah.
And actually embracing that, like for me, human nature just went bang. And I suddenly became aware of noises and the birds, and an appreciation for the walks. I used to, because you'd go, and it's odd, but so in some ways there's a positive side. You can do out. So I'm going on out. It's 10 o'clock. Oh no, it's 11 o'clock. Oh, it's 11 o'clock my time and 6 o'clock your time.
Yeah. And it's 8 o'clock for our Eastern status. So we'll let them go. But this has been recorded. If you have any other questions, please let us know. And please check out the Australian Institute of Health and Safety for other events that are coming up. Thank you.
No worries. Nice to meet you.